My name is Scott Dowell, and I'm the Director of the Division of Global Disease Detection and Emergency Response here at CDC.
Okay, we're talking about nodding disease. Now, there's a lot that we need to know about nodding disease or that we don't know about it, but as best you can, just describe nodding disease for us.
Yeah, it's a very strange disease. It happens in children who are previously healthy. And sometime between the ages of 5 and 15 years, they begin to develop the nodding. It happens most characteristically when they begin to eat, and as they're eating, their head just drops forward, and it can be very subtle. If you're watching a group of kids eating, you may see one, you're not sure if the eyes are just closing or the head was just nodding. But then over time you can tell that their head in fact bobs down, and then some of the more severe cases go on to develop other manifestations. Sometimes classic seizures, tonic-clonic seizures, where the child lays on the ground and seizes for a while. And then unfortunately they have deterioration in their cognitive abilities and their thinking. They often drop out of school. And then they have trouble eating, they lose weight, they get malnourished, and eventually many of them die.
Is there anything that's noticeable for the children themselves as they're, seemingly nodding off? Are they aware of it? Do they have any other symptoms that they complain about, headaches or anything like that?
Yeah, from talking to them, they don't like it, and some of them are embarrassed by it. So to reproduce the nodding, we often would gather the children around with their parents and feed them lunch. And some of the ones who would nod would then stand up once they recovered and move to another area as if they were shy or embarrassed about it. During the episode itself, they can become disoriented, so they can talk fluently but nonsensically.
And what are the causes of this, as best you understand it?
I wish we knew. It's really frustrating. We know now from the most recent investigation that it is a brain disease. There's clearly something wrong with the brains of these kids who have it. We've documented by MRI scans that the brains have some atrophy, and by EEG that the brain waves are abnormal. In fact, some of the kids with nodding have almost continuous seizure activity, although they appear fairly normal. So we understand the pathophysiology of nodding, but we still don't know what causes it.
Have there been any other clues, hereditary or anything like that you've come across?
There are an awful lot of clues. Yeah, there are a lot of clues, but it's hard to put them all together. This disease has been studied in a number of different areas, not just northern Uganda where we studied it, but also in Sudan, in central part of Tanzania for a number of years. And there are lots of theories about what may cause the nodding, but they're far-ranging, from exposure to munitions from the war, to psychiatric problems, nutritional deficiencies, some sort of infectious disease, perhaps a slow virus, perhaps an association with a parasitic infection. Lots and lots of theories, and we're trying to work our way through them one by one.
And why the young, do you think? A lot of those things you described, you would think that they might affect people of any age.
Yeah, and that's one of the most characteristic features of nodding disease, is that age distribution. It really is very tightly clustered between 5 and 15 years of age. In the study we did in northern Uganda, it was 93% of kids were in that age window. And I don't know why that is. Lots of theories about why that might be, but we're not sure. It does happen. There are infectious diseases and other diseases that have their onset in school-aged children, so it's not unheard of, but it doesn't necessarily give us the answer.
And what region, what countries are we talking about here that are affected?
Well, we were called to northern Uganda, Kitgum district, by the Ministry of Health in Uganda because they noticed a clustering of nodding disease in that district. It's also apparent that the neighboring districts, Pader to the south of Kitgum, also has some. Earlier in the 90s, there was an outbreak in Sudan, and there's a current outbreak in the Sudan also reported. And then back a few years, there was something very similar in Tanzania. So several different geographically focal areas in Eastern Africa have had this.
For northern Uganda, you were telling me earlier, what was the time frame when it first broke out and up to the present day? What kind of figures are we looking at?
Right. Well, it's clear from talking to the parents of these kids that this is something new and distinctive, that this is not found in previous generations. And when we ask about the onset of cases, the earliest ones go back to about 2003, and then the number of cases goes up, and it appears to continue to go up. So we're in the midst of the epidemic curve.
Now, this is happening in very poor areas where just basic health care is hard to come by. What is a health worker to do, or what is a family to do if a child in their community, if their own child is showing the signs of nodding disease? What can they possibly do about it?
Yeah, it's very tough, and that's one of the frustrating things about working on this disease is there is not a cure. One of the things we hear consistently from the families and communities is that the kids deteriorate. Some of them plateau and don't deteriorate further, but none of them recover. So there's no recognized episodes of kids coming out of this. And so they're managed as best they can by the family. When they get to the healthcare workers, the ones who have been in an area with nodding disease are pretty familiar with the features of it and can diagnose it pretty accurately. And they manage them with anti-seizure medications, which have a modest effect. As best we can tell, it decreases the number of episodes, but it doesn't fully control the disease.
And describe to me again, I know you did before, but describe to me again what the patient, what the person goes through from the early stages when it's first noticed, the dipping of the head, and then what happens from that point, and what is the ultimate outcome?
Again, it's a previously healthy 5 to 15-year-old child. So when you ask the parents about this child, this was a child who was growing, playing, going to school, doing well in school in most cases. And then the nodding comes on, and they have subtle closing of the eyes, dropping of the head while eating. At the beginning, it can be hard to figure out if it's normal or abnormal, but it progresses so that it's more regular. Often it's with eating, sometimes it's with cold air or when awakening. They give different prompts for the nodding to start, but it becomes more frequent over time. And then there are other manifestations of what we now recognize are seizures. Because of the brainwave EEGs that we did, we know that they're having seizure activities, and some of the kids have generalized tonic-clonic seizures where they're lying on the floor and they seize and they're out of it for a while and then recover. Because of this, the kids often drop out of school. They can't continue to go to school. They often lose weight because they're unable to eat properly. And then they get malnourished and may get other diseases. Some of the kids appear to stay that way with this sort of low-level functioning for months to years. But a small proportion of them die, and they die deaths that kids with chronic seizure disorders die. Some of them drown while bathing. Some of them fall into the fire and are burned. Some of them get malnourished and get an infection like a pneumonia and die from the pneumonia.
For those who survive, what happens to them as they get older?
We don't yet know very well. Keep in mind that the cohort that we've been following got sick beginning in about 2003 or so. So they're 7 to 5 to 10 years into their disease. As I said, some of them have died, some of them seem to be staying about the way they are, but as far as we know so far, none of them are recovering.
And what is the frequency typically? What is the frequency of the episodes for an individual?
It varies a lot, from 1 to 3 times a week to multiple times every day. And some of the kids have nodding episodes essentially every time they sit down for a meal.
Now this is a complete mystery. You have to play detective. Are there links that you're looking into? Some have suggested that there may be a link to onchocerciasis, river blindness. Others may be suggesting other things. What do you make of these potential links that you're investigating?
Yeah, we've followed up a lot of these links, and there are quite a few clues about possible etiologies, but we haven't figured out the cause yet. The association with river blindness or onchocerciasis is one that has come up several times. It came up in the investigation in southern Sudan, and we again found it in our investigations. The first round of testing, looking at skin snips, found a subtle difference between the cases with nodding disease and the control children, their friends and relatives without it, but it wasn't statistically significant. We got the blood test back and looked at antibodies, and it was significant. The kids who had the nodding disease were more likely to have had past exposure to onchocerciasis than the controls. So it's there, that association. We don't have a very good explanation for it, but we're continuing to follow it.
Do they think that it may be the same worm, just operating in a different way or interacting somehow differently?
Anything's possible, but it seems far-fetched. One of the main reasons is that there's lots of experience worldwide with onchocerciasis, and many places around the world with lots of onchocerciasis, whereas nodding disease is very focal in only a few places. So one would have to ask why, if onchocerciasis causes nodding disease, why doesn't it cause it in all of the other places where we have onco?
Now describe to me what the CDC, or how you go about investigating this. What are the things that you do? You've mentioned the EKGs, you've mentioned, just what do you do in the lab? What do you do on site there? How does that work? What are you doing to try to get to the bottom of this, to understand it better at least?
Right, well, the Ministry of Health in Uganda asked us to come help them to do this investigation, I think in part because we can bring a broad range of expertise to bear. So when we went out in December of last year, we brought a team that had nutritional expertise, environmental health experts, pediatrics, infectious disease, neurology, and so forth. And we could look at the kids with nodding disease from a lot of different perspectives, do a full range of physical exams, neurologic testing, and then bring back specimens to the laboratories here in Atlanta where a huge range of pathogens can be looked for. So we are able to go sort of step by step through a lot of the hypotheses. And many of them turn out just to be dead ends. We look for evidence that there was some sort of toxic exposure. We didn't find that. We look for common exposure to water sources that might be contaminated or poisoned in some way, and the water sources were varied. We mapped out the distribution of the kids in geographic terms across Kitgum District to see if there were clues there. There weren't very good clues. And one of the basic tools that we use is a case control study, where we take cases with nodding disease and we compare them with controls from the same household or same community without nodding disease, and we try and say, what's different? What is it that these kids with nodding disease have been exposed to that their relatives or their friends have not? And that's often the most productive help. And we've done 2 rounds of that and are getting some clues from that.
In terms of concerns about the spread of anything like this that's not well understood, from the time that you first started looking into this disease, have there been any changes, either an expansion or smaller numbers or greater numbers, or geographically any changes?
Unfortunately, in Kitgum District, the numbers of cases have continued to increase, even since our first investigation of a little more than a year ago. We also have now been hearing about additional cases occurring in Sudan. This, remember, was an area in the 90s where there were cases of nodding disease, and now we're hearing about additional cases. It's rather difficult to work in the Sudan right now because of a referendum and some political unrest going on, but we're anxious to learn what we can about what's going on there as well.
In terms of whether this is infectious or not, what are you seeing there?
Well, it's a concern. We went around to the different infectious disease expert groups here at CDC to start with and asked, does this fit any of your pathogens? And everybody said, not ours. So it doesn't appear to fit well with the pattern of any known infectious disease, but that doesn't mean it's not infectious. We've certainly seen this before. There are some things that seem to point in the direction of an infectious disease. There's the geographic clustering, there's the clustering in time, and there's also clustering within households. So there are some households that have more than one case as well. So some clues that there may be an infectious component, but it's not definitive.
And as with the case with Uganda, the government or the Ministry of Health had asked for your help, presumably because they don't have the resources that you have or the know-how. Is this the only way that they could handle something? I mean, are they extremely concerned about this becoming a greater threat? What else can they do beyond turning to the CDC?
It's a significant concern for the Ugandan Ministry of Health. Obviously, they have part of their population that's being affected by this, and so they have been and continue to be interested to do whatever they can to get to the bottom of it. They've put some of their best researchers on this as well. So our team joined up with pediatric neurologists from Makerere University in Uganda. We had pathologists from Uganda come here to work with our pathologists at CDC, investigate a brain specimen from one of the children who had died. So there's lots of back and forth collaboration on this. I think everybody wants to sort of put their best people forward to try and figure out what's going on.
It's terrible, and yet it's fascinating as well.
Mm-hmm.
From your perspective, where do you see? I mean, have you seen anything like this before? And if so, where do you think you can go with something like this? I mean, how long could you be looking at this still in 20 years' time? Or from your experience, do you tend to understand it fairly well to be able to treat it reasonably effectively in a shorter period of time?
Yeah, we do see this. We see mystery diseases on a regular basis. Some of them we quickly figure out, and some of them take time. Some take a couple of years, and some go unsolved for decades. Usually they get figured out eventually, and I would be optimistic that at some point here we'll figure out the cause for nodding disease, and that's probably the most important step towards being able to help these kids and to provide a cure or a prevention for this disease. But so far we're still marching our way through the different ideas and ruling out the things that don't fit.
And last question, is there any kind of a formal group that, the CDC is obviously looking into this? Is it working with partners? Is it doing this largely independently while other organizations are looking at it as well? Is there any structure to the investigation into what this is and how it can be treated?
Well, the formal organization that's most relevant is the Ministry of Health in Uganda, since it's their disease and their people who are being affected. And they will call in groups that need to be brought in. Obviously, when it becomes a problem of international concern, that is a problem affecting not just northern Uganda, but also Sudan, Tanzania, potentially elsewhere, then it becomes a problem that agencies like the World Health Organization, CDC, and others begin to be interested in from that perspective. So we have been working with the World Health Organization and others, trying to pool resources and do our best to figure this out.